Okay, what are patients asking for? I'm gonna say salmon DNA. The funny kind of term for it is a salmon sperm facial. This is really big right now. This is why people, I think, are asking for it, because there's been a lot of celebrity chatter with it, and we know I love celebrities and celebrity tea. The fanciest kind of scientific term for it is polynucleotides, and that again is a skin booster. So it regenerates our cells, it helps even our skin tone, it produces collagen. They're basically topical collagen stimulators, and we micro infuse them into the skin. So that's been the one lately that people have been coming in and actually asking by name for a salmon DNA facial. What is your favorite / most popular treatment? This one's tough because there are so many, and like I said, I'm obsessed with everything, and so I feel like all my treatments, it really depends on the patient, but right now I think my favorite child is skin boosters. So that's when we do microneedling or microinfusion. What that means is we use little tiny needles to infuse basically a vitamin into your skin. Why I love it so much is it stimulates a ton of collagen. You heal very quickly because it's a very regenerative treatment, and then we get this beautiful like sparkle in 2 weeks. Okay, I had filler under my eyes in the past, and now my eyes are puffy. Is this from filler? It's possible. So for one, I get lots of questions, kind of like personal cosmetic questions in my DMs, and sometimes they're really hard to answer without really seeing the patient in person. Puffiness can be an outcome of filler in the under eyes, and it's why I personally have gotten away from using filler for under eye treatments, or what we call the tear trough, or that volume loss underneath our eyes. I think now we're really lucky. There's lots of regenerative treatments that we have that can really replace volume in that area and kind of rejuvenate our under eyes without using filler. But what I tell people with filler in general is what it does is it kind of slows the drain. So there's little points in our face that help us drain that lymphatic fluid, or drain that water that we can kind of hold on to. And sometimes filler, when it's not in the exact right area, it can kind of plug the drain a little bit, and we'll see some puffiness, especially under our eyes. That's also an area that's very unforgiving. The skin underneath our eyes is like a sheet rather than a comforter. And so if there are any irregularities in that area, we'll see them. They will come out, we will see them cosmetically. So now I focus really on regenerative treatments for the under eyes so that we can get the same beautiful result, but we don't have to use something that could potentially create issues down the road. Let's see. Oh, this is a good one. Is filler migration real, or is it just another clickbait topic? Yes and no. There's never really a simple answer in aesthetics. Filler migration is real, but I think it is grossly over-reported. I think where it can occur, and where I see it mostly, is when filler's being kind of overdone. So I see it a lot in our lips. Our lips are a closed compartment, so that means they can only really hold so much volume. What happens is when we kind of inflate it, it's almost like a balloon. If you overinflate it, eventually it's gonna pop. With filler, and especially lip filler, when it's overdone, our muscle can start to kind of push it beyond the border of our lips, and that's when we see filler in areas that it wasn't originally injected. When filler is used properly and in the proper amounts, migration is very rare. The nice thing now is when it does occur, there's lots of things that we can do to undo it. So the best thing about filler in my book is that it's reversible. It's completely reversible. We can dissolve it overnight. So when I notice migration on my patients, if I see any filler beyond the border of the lip, or filler that we placed that is not in the correct area, or cosmetically it's creating a new issue, then we simply dissolve it and we start over. Right now it's a buzzy topic and everybody's kind of talking about filler migration. Does it happen? Yes, but when it's done in the right way, it's very rare. Okay, what is Sculptra, and should I ditch tox for it? First of all, no, we should not ditch tox for it, but Sculptra is an injectable biostimulator. So that means it's kind of like a fertilizer for our face. We inject it in areas where we want to see collagen stimulation. So we lay that fertilizer down in our face, and then we let our body come and produce that collagen where it was injected. When we take collagen, like we eat collagen, or if you're taking a collagen supplement, that's a great source of protein, but you can't really tell your body where to use it. So basically what Sculptra is, it's telling your body, okay, you have all of this collagen and you have the ability to produce collagen, so here's where we want it. We want it in our face. So that's kind of how it works. Should you ditch tox for it? No. So they're completely different treatments. Tox works on expression lines. It can work in our full face. We use neuromodulators or neurotoxins like Botox and Dysport, but it targets muscles that create expression lines. Sculptra stimulates collagen, so it's good for skin firming and slow volume creation or revolumizing the skin, but it's not going to work the same way as tox. Yes, you should try these biostimulators like Sculptra, but no, you shouldn't ditch your tox for them. A big question, I get this every day, this question. If I do Sculptra now or I do an injectable biostimulator now, can I still get a facelift later? And the answer is yes, you can. So there's been a lot of talk, especially on social media, with plastic surgeons that feel like if you have a Sculptra treatment that you won't be able to get a facelift. Here's why I don't think that's true. Facelifts work on a plane in our face called the SMAS, which is basically like a connective layer in our face. And when plastic surgeons are doing a facelift, they lift the SMAS. Sculptra is not injected in the SMAS, so it really shouldn't inhibit or get in the way of a plastic surgeon's ability to give you a facelift. The way that I approach it in my practice is if you have immediate plans for a facelift, so that means within 1 to 2 years you're planning on having a surgical facelift, then we can use other products that have no potential to inhibit anything that a surgeon's going to do when they're performing your facelift. But if surgery is not an option, which for some people it isn't, maybe you're not a candidate or it's not something that you're interested in, there's lots of patients that don't want a surgical facelift, then Sculptra is perfectly fine to use, and so it really comes down to right patient, right time, right plane. What is biostimulation and when should I start? I get this question a lot too because I go on and on about biostimulation. So biostimulation is using your body's own process to turn back the clock on your skin. It's kind of a blanket term. It's a term that a lot of different treatments fall under. There's injectable forms of biostim, there are topical forms of biostim, there's lasers, there's microneedling, there's microchanneling. All of these things kind of fit under that umbrella term. So biostimulation is really any regenerative treatment, and it really focuses on how your body responds to the treatment to build collagen. My favorite biostim is Sculptra. The kind of fancy term for it is PLLA. It's poly-L-lactic acid. It's an injectable biostimulator. Injected in areas where we see skin laxity or volume loss. So what I tell my patients, it's like a fertilizer treatment. It's kind of like fertilizing your lawn. So we place it in all of these areas that we need collagen built, we need subtle volume, we need skin tightening. You won't really see it. You'll go home and you'll say, I spent a fortune and I don't see anything happening. This is where trust the process comes in. And then over the course of months, like 6 months, your body will produce collagen in all of those areas where that fertilizer was placed. So that's my favorite biostimulator. The tricky part of that question is when do I start? Because really the answer is everyone's different. It comes down to a consultation and figuring out what's right for you. But really taking care of your skin early on is better than kind of trying to turn the clock back later. Tell me what Demi, Lindsay, and Christina have had done. Ooh, this is a good one. So I have an ongoing series on Bailey's Bougie called What Have They Had? And it's where we break down celebrity cosmetic treatments and my best professional guesses on what they've had. Sometimes they're stumpers. I feel like Lindsay right now is a little bit of a stumper, but I think for all three of them, it's a mixture. It's kind of the perfect combo of non-surgical and surgical work. So I think they've had early facelifts, which is really popular among Hollywood stars right now, like a facelift or a ponytail lift in their early 30s or 40s. They combine that with regenerative injectables to get this really sparkly, beautiful glow. I think Lindsay especially did an upper bleph, a ponytail lift, she got cosmetic dentistry, and then she really did this beautiful, gorgeous, her injector is amazing, facial balancing and using injectables in the right way so that we don't really know what she's done. She just looks absolutely gorgeous. What is bio beauty? Bio beauty. Okay, yeah. It's my term for regenerative aesthetics. There's lots of things in our body that can help us anti-age. So bio beauty is using our own body's processes to turn the clock back on our skin. And it's the basis, the foundation for regenerative aesthetics.
Did you pay for parking?
No, I'm gonna get a ticket, whatever.
I know, I'm gonna get a ticket too.
I'll pay for your ticket. Does masseter tox or jawline tox cause jowling? This is another really buzzy topic right now on social media that I've seen a lot. And it really, again, comes down to the right patient, the right amount, the right placement, the right time. Technically speaking, can masseter tox cause jowling or worsen jowling? Yes, if it's done on the wrong candidate. So if there's a lot of lower face laxity already present, it's not going to be a treatment that I would recommend for someone like that. If it's a younger patient that's struggling with TMJ symptoms, so you're clenching, you're getting headaches, you're grinding your teeth at night, masseter Botox can be a complete game changer because it has a cosmetic effect, but it also has a medical effect in helping TMJ symptoms. It's a very popular treatment and I use it almost every day, but it has to be for the right person. Your injector should be assessing you before recommending a treatment like that. If there's a lot of jowling present or a lot of lower face laxity, then I'll start very low on the dosing. So we start low and we go slow, and that's how I do all of my injectables. Start low, go slow. If you're still having those grinding symptoms or you're still having those TMJ problems, then we'll slowly increase the dose until the symptoms are gone, but the cosmetic effect is favorable. If the person is not a great candidate, so if they already have a lot of jowling present, then it might not be the right treatment for that person. Javel, okay. Can you leave that in? Okay. What are your thoughts on Jeuveau? Ooh, okay. So yes, this is another really common question between the different brands of Botox. So Jeuveau is just another neuromodulator or neurotoxin like Botox. Botox is like the Kleenex of neuromodulators. It's the one everyone knows about. It's the household name. So Jeuveau is a newer form, and I lovingly refer to it as Botox's little sister. So it's like the new version, the new cute version of Botox, and it works very well. I tell all my patients, it doesn't really matter which brand you choose. Some brands it might respond better, or you may get a longer duration, or you may like the look of it, but it's very subtle because all of the brands contain the same active ingredient, so they all work the same way. They relax muscles that create expression lines. So Jeuveau does the same thing as Botox, but sometimes it can look a little different or last a little longer for different people depending on how your body responds to it. I personally use it a lot for my younger patients, so people that are starting a little earlier with neuromodulators, because I just like how it works and it looks very fresh. You get a very glassy kind of look to the skin, but In the long run, it's not really much different than the other brands. It's just which brand is the best for you. Okay, I'm thinking of starting Botox, but I'm worried that I'll look worse if I decide to stop. Yes, very common worry. So the quick answer is no, you'll never look worse for starting Botox. It actually has the opposite effect. So Botox relaxes muscles that create expression lines. Depending on when you start will kind of dictate how many lines are there and how deep they are. The sooner you start, typically speaking, the less lines are present and the softer they are, so they go away a lot faster. When you stop, your body is now aging from the point that you stopped. So instead of, let's say I started Botox at 22, that's when I started, which is very early, so don't do that. But I started Botox at 22, and let's say I stopped when I'm 28. I'm actually aging now from my 22-year-old skin and not my 28-year-old skin. When you stop, you're simply aging from that point now. So you're going to form those lines and wrinkles that went away while you were on it, but it's coming back even more slowly than it would if you had never started, because now your skin is aging from 22 rather than 28. Okay, does filler stretch the skin? And if I dissolve it, will I look worse? This is a really common thing I see. I do a lot of like myth busting on social media, and this is one of the big ones. And I get why. When we put filler in, that it'll in some way kind of stretch out the skin, but it actually doesn't do that. It takes a ton of filler to do that. So grossly overfilled lips that are beyond recognition, that potentially could stretch out the skin in your lips. But for the most part, when filler is used to replace lost volume, which is the whole point of filler, that's really how it's supposed to be used, to replace volume, fat, bone, collagen that we lose every year, we use filler to replace that, not to add more than we ever started with. So when we're starting to kind of get to that point where you're putting more in than you ever had, then maybe potentially it could stretch the skin, but you'd have to use an enormous amount. Okay, let's see. I have an autoimmune condition. Does that mean I'm not a candidate for filler? That's a great question. I get this question a lot with my patients. No, the short answer is no. You can still have filler, but for people with autoimmune conditions, a consultation is so important because we do need to know all of those things, even when we're just doing these elective cosmetic treatments. When we use cosmetic injectables, they're called biomimetics. So that means they match very closely the things that we already have in our body. However, it's not a perfect match. Filler is made out of hyaluronic acid. We have hyaluronic acid in our body. It's in our joints, it's in our skin, but this hyaluronic acid is a little slightly different. So for someone with an autoimmune condition where their immune system's already kind of searching for things that are different and already recognizing things that aren't different, like it's finding stuff that is part of you that it thinks is not. So your immune system is already trying to search out. And what that means is it does a better job of kind of finding these injectables. So it puts you at a slightly higher risk for some of the adverse outcomes that can happen that are pretty rare for people without autoimmune conditions. For my autoimmune patients, I really focus on regenerative treatments. So let's use the stuff that you already have in your body. So for example, PRP stands for platelet-rich plasma. It comes from our blood. So we draw blood, we spin it into this really rich serum that has growth factors and proteins and peptides, and we use that to regenerate our under eyes or produce collagen in an area. So for my autoimmune patients, I focus heavily on treatments like that. So let's use the stuff that you already have in your body to have the same sort of effect as an injectable, and it will have a lot lower risk of having a reaction to it because it already comes from you. I think that's it.